Hello, welcome back to my channel. I am Nurse Marsha, a retired nurse with over 30 years experience. I created my channel to help educate people on how to better manage their illnesses and diseases. I also want to help you learn how to better navigate through our complex healthcare system here in America. So today I thought I would share with you my personal experience while taking Ozempic. That's right, Nurse Marsha is taking Ozempic. We all have heard about the craze, how Ozempic is making people lose weight. All of the people in Hollywood and on our TV screens have taken Ozempic and they have lost weight pretty quickly. But that's not why Ozempic was created. Recently, so many people have called Nurse Marsha and they say to me, Ozempic is the same as insulin, right? And I have to educate them and say, no, insulin and Ozempic are not the same. Insulin is insulin. Ozempic is Ozempic. Ozempic is not another form of insulin. I think people get them mixed up because both has to be injected. So exactly why was Ozempic created? Ozempic was created as an add-on in the treatment of type 2 diabetes. Usually, if you have type 2 diabetes and you're taking Ozempic, you are taking other medications to help manage the type 2 diabetes. Ozempic is also used with diet and exercise to help you get better or lower blood sugars if you have type 2 diabetes. It also helps to prevent some of the major complications of people with diabetes, such as heart attack, stroke, and even death. So how does Ozempic work in our body? Well, number one, Ozempic tells our pancreas to produce more insulin in our body or release more insulin in our body when our blood sugars are high. Number two, it also tells our liver not to produce and release so much sugar into our bloodstreams or into our bodies. Number three, Ozempic slows down the digestive system. In other words, it slows down the food from leaving our stomach quickly. Therefore, if the food stays in my stomach longer, I feel full longer. Therefore, I am not going to eat more. That is the reason that Ozempic produces weight loss. But that was not its intention. My personal experience with Ozempic gave me some side effects that I want to share with you. Let me give you some possible side effects of Ozempic. Ozempic can cause nausea, vomiting, diarrhea, constipation, blurred vision. It can give you inflammation of the pancreas, kidney disease or kidney failure, a really bad allergic reaction. Some people can be allergic to Ozempic. Gallbladder problems. More serious side effects, the side effects that Nurse Marsha had, and I didn't realize it for such a long time. I started on Ozempic with a low dose, the 0.5. Ozempic comes in 3 doses, 0.5 milligrams, 1 milligram, and 2 milligrams. So Nurse Marsha started out with a low dose under my doctor's guidance and orders, and I had no problems, right? Easy breezy. So after a couple months, my doctor increased it to 1 milligram. Easy breezy, no symptoms. I continued taking that 1 milligram for about 4 months. At 4 months, I started having some strange side effects. I started having cold-like symptoms. I had a runny nose, I had a sore throat, I had a productive cough. I always wanted to clear my throat, and I was hoarse. Sometimes my voice would just disappear. The sore throat was very painful, as if I had a sore throat with the cold or the flu or even COVID. So I went to the urgent care and they treated me with antibiotics. I had a COVID test. I even was tested for strep throat. Nothing came back positive. They were both negative. But my doctor treated me with antibiotics. I went home, completed my antibiotics, about a 7-day dosing of antibiotics, and everything cleared up. I'm back to normal. So I'm thinking, okay, no problem. It's just maybe a virus. Seems like the moment I stopped or I completed my antibiotics, those symptoms came right back. Started having runny nose, sore throat, productive cough. My throat was very, very sore, and this time whenever I swallowed, I felt like something was in my throat. Even at night, I started having pain in my throat. I thought it was maybe the way I slept. Back to the urgent care I went. I had another dose of antibiotics. Completed the antibiotics about 7 to 10 days. The symptoms came right back. This time the symptoms, they hurt more. The throat was driving me nuts. Sometimes I couldn't even turn my head. And I was thinking, this is not a virus. Something is going on. So a light went off in my head and I thought to myself, it's gotta be the Ozempic. So I went back, I reviewed the side effects of Ozempic. And guess what? I found some more serious side effects of Ozempic could be thyroid tumors. Now the thyroid is the gland that sits right here in our necks. It actually covers, if you will, our throat internally, of course. I also read that Ozempic can cause the lump in your throat. That lump could lead to thyroid cancer. So of course this was alarming. Again, always stop medications under your doctor's guidance. So being a nurse over 30 years, I kind of took a little liberties. So I stopped taking my Ozempic, but I did notify my doctor. And I said, hey, I'm going to do a test. I'm going to stop taking this Ozempic and see what happens. I stopped taking the Ozempic, and a few days later, my throat cleared up. I had no more hoarseness. I had no more sore throat. I had no more productive cough or runny nose. I felt normal. I did follow up and I had a physical exam with my physician. Since I had been okay or had no symptoms while taking the low dose of Ozempic, I suggested to my doctor that, hey, would it be okay if I just go back down to Ozempic 0.5 milligram because I did not have any symptoms while taking the low dose. He agreed, and I stayed on Ozempic 0.5 milligrams. I do not have any symptoms, and good news, I have better blood sugars, and also I have lost 20 pounds. But please remember to always report side effects to your physician. Again, never stop or start medications without being under the guidance and direction of your doctor. I hope this helps. Don't forget to subscribe to my channel. Hit the notification bell so you will be aware of any uploads that I do. If you have any comments or questions, leave it below. And also, don't forget, sharing is caring. So share Nurse Marsha. Don't keep me to yourself. Bye.